welcome. And I want to especially welcome Brent, Amy, and Justin. Justin Moling, Amy Cook, and Brent Fraser. And I apologize again to them. They were here last week, and we didn't notice this in the procedure according to protocols. So they were still nice enough to come back, and this will be recorded for the folks who aren't here to explain and tell us and take some questions with regard to a number of veteran-related issues from the hospital I met Justin 2 weeks ago to suicide prevention event up in Plymouth. So thank you for being here and for passing out these wonderful materials. And we have some folks that are inbound, and like I said, this is being recorded. So we'll lead off with Justin and Amy, and then Brent. And as soon as Justin's done sharing these goodies, we'll start with him.
Could I share a little story?
Yes, and I want to thank Representative Carey too. She was a prime mover behind this information professional development session. Representative Carey.
Thank you, Representative Moffett. And part of the reason for having this session today has to do with one of our committee members who shared a story with me. He is not able to be here today. He has to work, but he asked if I would share his story. He is himself a veteran, Representative Finney, and he found himself in crisis, in such crisis that his friends said to him, if you don't go to the hospital now, we will call the police, because that's what we know to do in the community, right? If someone's in crisis, we don't know what else to do, send him to the hospital or call the police. So he did, at the behest of his friend, go to the hospital, and the hospital examined him and released him with no assistance whatsoever. And so he is very concerned because he said, you know, when I was in the military, you knew if you were in crisis, you kept it to yourself, you sucked it up, and you worked through, battled through your demons. And he said, but going to a hospital, admitting that you had demons and that you were struggling, and then being turned away to go back and do exactly what you had done while serving, he found that very, very, very difficult. And I can't tell you in the line of business I'm in how many similar stories I've heard over the 33 years I've been in business of veterans sharing the same, and some don't make it. Some don't. They end up at the veterans cemetery. And I think all of us would like to see some better outcome than that.
Thank you so much, Representative Carey. Justin, welcome. We'll start with you. I mentioned I met you up in Plymouth recently. I have your business card, but if you could start off by just telling us, if you weren't already going to tell us, you know, what you do, and then you can get into some of the things that you think we should be better aware of.
Thank you for having me, Mr. Chairman, Representative Carey. Appreciate you reaching out to the VA. My name is Justin Mailing. I'm a resident of Litchfield. I'm a social worker by trade. I have been working at the Manchester VA Medical Center for approximately a year and a half. Prior to that, I was working at the Jamaica Plain VA down in Massachusetts. I am a veteran myself. I was in the Coast Guard for 6 years, and I am also a client of the VA. I am fortunate in that it's because of the VA that I was able to become a social worker. It was through vocational rehabilitation that I was able to get to where I am today. I'm very grateful. What I'd like to do is start a little bit from sort of the larger picture of the overall VA suicide prevention program, and then that will sort of naturally come down to what I do and a little bit more of what's happening here in New Hampshire. The Veterans Crisis Line that folks are potentially familiar with, if you dial 988 and then press 1, rather than reaching the local crisis line, you will get transferred to the VA's Veterans Crisis Line, where we've got trained clinicians answering phone calls 24/7. A while back, we just had one call center in upstate New York. Over the years, we've tripled in size, and we have call centers in upstate New York, Atlanta, and in Topeka, Kansas. The 988 press 1 for the Veterans Crisis Line. It's available to all veterans and anybody that's concerned about a veteran. The folks that answer the phone are prepared to talk to somebody who either is with somebody who's in crisis, somebody who is in crisis, or somebody who's concerned about somebody in crisis. The folks on the other end of the phone line, they start by just getting a sense of what's happening for that individual and triaging the situation. They have the ability to get emergency services underway to support that person if that's what's needed. That does not always happen. It doesn't have to, it's not an automatic rollout like if you called 911. At the end of the call, depending on how things go, if the person would like, they can be referred and connected to their local VA, at which point that call then gets referred locally to our suicide prevention coordinators that are, they're tasked to follow up with those calls within 24 business hours. So it makes a difference if it's a weekend or not, but they are responding to those calls on a regular basis. They do follow-up, case management, referrals on a case-by-case basis. Veterans at risk are tracked, they're monitored. The suicide prevention coordinators provide both internal and community-based suicide prevention training. VA SAVE training is available free to community partners and stakeholders. And that's something that we've been doing in the last year. Through and coordinated by the suicide prevention coordinators, we have our general mental health clinic. So that winds up being part of our suicide prevention structure. Full range of mental health care is available either at our local VA, or folks can be referred to one of the other medical centers in the region. We have the entire VA at our disposal as needed. The VA offers what we call same-day access. If somebody walked in, the idea really centers around the no wrong door approach, which means if somebody walked in off the street, somebody would be able to meet with them. Now, what that tends to involve would be triaging the situation, identifying if there's a crisis, and if we need to respond in a crisis situation, we would do so accordingly. And then if it's more routine, then that person will leave with a referral and an appointment to come back. But the idea being that we've had folks that are ready to support veterans at any point in time during our business hours. That is one of the sort of unique aspects of the Manchester VA, is that we are not a full service medical center. The two full service medical centers that folks may be familiar with that have emergency rooms and the full range of care are White River Junction, Central Massachusetts, and the Boston area. There are other medical centers around. Manchester has an urgent care. Bedford has an urgent care. And then there's also various ancillary services that are available there as well. The mental health service has a mental health case manager. It's a nurse who's assigned with assisting with the facilitation of transfers between facilities or between the emergency room and community providers. So if somebody showed up to the Elliott emergency room and Elliott is looking to get that person transferred to Wright River Junction, just for an example, this is somebody who's there who's working to build those connections and make those transitions as smooth as possible. My role is part of the community-based interventions for suicide prevention. It's a fairly new program. When I was hired about 1.5 years ago, this was a new position for the Manchester VA. The idea is that with over half of veterans that are eligible for VA care choose not to pursue their care at the VA, for us to have a true impact on veteran suicide, we need to support our veterans in the community where they're getting their care and get beyond the walls of the medical center. The VA has identified that the best way to get out there and to quickly multiply that effort is through community coalitions and building coalitions. My job is to build those community coalitions, support our partners in the community in order to approach suicide prevention from a public health perspective. That includes training community folks in suicide prevention and how to talk to somebody who's in crisis and where to find resources. It includes encouraging folks in the community that are supportive of veterans to advocate with their local providers, to encourage them to screen in order to identify veterans. Because if we're not asking if somebody's a veteran or not, then we can't get them services. New Hampshire is a national model with the Ask the Question campaign. The VA uses New Hampshire as a model for that. And the whole point is to really encourage as much as possible, as universally as possible, to ask folks, have you or someone or loved one ever served in the military? You ask that question, and then the idea is you also have to support people in what to do next. If the person says yes, then what? And that's part of what we're working to do from this public health approach. There's 8 total coalitions in the state so far that came together in the last year. One of those coalitions is a little bit more administrative. It's kind of designed to bring people together to facilitate the process of creating coalitions. So it doesn't quite apply, but it fits the definition. We have coalitions. We've got the Stronger Together Coalition is out of Milford, out of the Addiction Recovery Coalition of New Hampshire. Greater Manchester Veteran Suicide Prevention Coalition is hosted by both Easter Seals and Forge Health with Sean Kilbreth and Stephanie Higgs. The Sullivan County Veteran Suicide Prevention Coalition, they recently named themselves Granite Hope. They are hosted by the West Central Behavioral Health in Claremont with Bill Metcalf. Seacoast Veteran Suicide Prevention Coalition recently got started through the Seacoast Public Health Network and Samantha Arison. Carroll County Veterans Coalition, hosted by the Carroll County Coalition for Public Health, led by Jen Thomas. Capital Area Veteran Suicide Prevention Coalition, they're about to have their first kickoff meeting. That's hosted by the Capital Area Public Health Network with Ashley Sullivan, Vanessa Healy, and Kaylin Amok. I mentioned these folks' names because I encourage folks to track them down, especially if you know folks that might want to be involved, or if you want to learn more, especially if these are folks that are from your district. Central New Hampshire Coalition is hosted by Central New Hampshire Katie out of Plymouth. That's turning out to be a wonderful coalition. They've got some great connections with Plymouth State University, and it will be interesting to see how that comes together. The last thing I wanted, or the last coalition I wanted to mention that folks may be familiar with is the Lakes Region Veterans Coalition. That actually came together under a program before I was even hired that was out of the VA Office of Rural Healthcare, but the structure of that program overlaps almost perfectly with my job and my role and the nature of the program. So we sort of just kept that within the umbrella of all of them together. That is, the contact for that is Kurt Weber. It's up there connected with Camp Resilience. They're really doing some wonderful stuff. That's probably, if you think about the age and development of a community organization, they're the most developed with the board of directors and bylaws, and they're incorporated and that sort of thing. The last piece that falls under my purview as a program coordinator involves the New Hampshire, well, it's the National Governors and Mayors Challenge in New Hampshire, the New Hampshire Governors Challenge for the prevention of suicide for service members, veterans, and their families. That project or that program now lives within the New Hampshire Suicide Prevention Council and the Military and Veterans Committee of the New Hampshire Suicide Prevention Council, of which I co-chair with Amy Cook. So that's a brief overview of all of the different aspects of the VA's approach to suicide prevention. And that sort of segues into Amy's presentation. Thank you for having me here today.
Thank you, Justin. And same thing, Amy, if you can, I know you've changed jobs during your journey. So if you could update us on where you are, and then tell us some things that we should know better.
All right. Good afternoon. My name is Amy Cook, and you have a folder in front of you that I passed out. You'll notice that my business card and my email address is with NAMI New Hampshire. I started working there in January of 2023. Yes, a year ago. I had to think for a second. But I'm here today in my role as the chair of the New Hampshire Suicide Prevention Council, the co-chair with Justin of that council's Military and Veterans Committee, and the team lead for the New Hampshire Governor's Challenge to prevent suicide among service members, veterans, and their families. Prior to moving to NAMI, New Hampshire, I was the division director for the Division of Community-Based Military Programs at the New Hampshire Department of Military Affairs and Veteran Services for many years. When it first opened in 2019, I had already been in that position at DHHS for about a year and a half at that time. So come with great experience working in the community-based sector of this field, and really a passion coming from a military family with a strong growing up military, right? My parents, grandparents, we have a Medal of Honor recipient, Pearl Harbor survivor, Vietnam veteran, OEF, OIF, combat veteran, and the list goes on and on. So I grew up thinking that the military was all parades, because my grandfather and my great-grandfather, marching in parades with them. For me, it was all about balloons and excitement. There's a school named after my great-grandfather in Massachusetts. And it wasn't until I became an adult and really started to work in the field to know that it's not all balloons all the time. From the story that Representative Carey shared in the beginning, there's really some gaps in services. I have not served myself, but I see myself as an advocate for those who have. I know from my own family experience, typically, and for those of you who are veterans, I imagine you might find yourself in the same position, that sometimes it's hard to be the person who advocates for yourself. It just feels strange sometimes. So I love to step into that role and say, yes, this is what we need to do for our veterans. So I'm so incredibly happy that Justin asked me to join him today. So in that folder that I gave to you, the one thing that I'm going to refer to the most is this, this big piece here that has the wheel in the middle of it. So when you're and please review it. I put together the folder because I knew we were limited on time, so I expect it to supplement what I'm just going to highlight here for you today. So I won't be offended that you're reading through it, looking at it, and not looking at me. I encourage you to do that. But when reviewing this document that I just showed you, that has a whole bunch of suicide prevention initiatives for veterans in New Hampshire, I hope that two notable aspects will be apparent to you. First, the broad spectrum of services and supports that are available. And second, the high degree of collaboration that exists between the VA, state departments in New Hampshire, and community providers. So suicide prevention for veterans is undeniably an important public health issue, demanding a comprehensive and multifaceted approach to make a meaningful impact. Addressing the challenge necessitates an approach that goes beyond individual mental health counseling. It requires a broad array of services that span mental health care, community support, education, and outreach initiatives. For the military and veteran community in particular, Representative Carey had touched on this in the story that you shared in the beginning. Mental health awareness campaigns play a pivotal role in reducing stigma and encouraging people to seek help when they need it. Accessible and effective mental health services, including counseling, crisis intervention, are imperative components of the supportive system, but additionally, community-based programs fostering social connectedness, resilience, and early intervention contribute significantly to preventing suicide. They all relate to that wheel that you see in the middle that really personifies the quality of life for a veteran here in New Hampshire. Collaboration between healthcare providers, educators, you as policymakers, and community leaders like us here are essential to create a unified front against the public health challenge of suicide. So we really need to emphasize ongoing research, policy development, and resource allocation to truly make a difference in the lives of our New Hampshire veterans. The VA, the New Hampshire Department of Military Affairs and Veteran Services, the New Hampshire Suicide Prevention Council, and community providers are really the primary stakeholders leading New Hampshire's suicide prevention efforts. Collectively, those entities, we focus our efforts using the National Strategy for Preventing Veteran Suicide, the CDC's Preventing Suicide Technical Package, New Hampshire's State Suicide Prevention Plan, and the one you're probably most familiar with, New Hampshire's 10-year mental health plan. So notable statewide initiatives that are really briefly mentioned on this handout for you that I really want to make sure you know about are first the Governor's Challenge to Prevent Suicide among service members, veterans, and their families. Justin mentioned that. It started in 2018. SAMHSA and the VA began supporting teams under this program. And New Hampshire, proudly, we were one of 7 states to start in that inaugural year. Since that time, we've been active in developing goals and action plans, implementing and meeting objectives, tracking outcomes, and just continually assessing needs. So the team continues to meet monthly. We're very active. As Justin mentioned, we're now embedded in the New Hampshire Suicide Prevention Council so that we can have some sustainability there, increase our network, and the impact that we have. So this team primarily focused its efforts on educating New Hampshire providers about military culture and suicide prevention, promoting the Ask the Question initiative that Justin mentioned, and supporting the development of the local veterans coalitions in this past year. I actually had the privilege of going down to work in Washington, D.C. last week with the last 8 teams to join the Governor's Challenge. One of those state teams, so seven states, including Maine, actually, is one of the last ones to join, and the Commonwealth of Northern Mariana Islands. So it's exciting that now all 50 states and all U.S. territories have a Governor's Challenge team. The other thing of notable interest is the Staff Sergeant Parker Gordon Fox Suicide Prevention Grant Program. It's a big mouthful. but it comes with a lot of responsibility. It comes with a lot of funding. So we are super excited to have a recipient here in New Hampshire, which is Harbor Care. So they were awarded this suicide prevention grant during the first round of that federal program. They've developed and are implementing at this time a comprehensive array of services focused on suicide prevention for veterans. And they're collaborating with other statewide groups and the local veterans coalitions as well. And then lastly, state-funded suicide prevention projects. Easter Seals New Hampshire and Partnership for Public Health were selected through a competitive RFP process by the Department of Military Affairs and Veterans Services last fiscal year to implement services to reduce social isolation and increase access to mental health services for veterans in New Hampshire. So this funding, unfortunately, was a one-time allocation. It ended last June. However, both organizations are really continuing that work that they started with the funding. So they're now in the process of trying to figure out how to access different funding sources to keep it going, or to at least build on what they did do so it doesn't completely end. And then lastly, and kind of related to that, Easter Seals, as you may be aware, they were provided an allocation of state funding to move forward with some really innovative plans to develop a veterans campus in Franklin, New Hampshire. So that's going to offer veterans across New Hampshire a comprehensive array of services to address many of those social determinants of health that you see on that wheel from that handout. So the good news is that's a lot. The good news is that there is a lot. The good news is also that between 2018 and 2021, the New Hampshire veteran suicide rate continued to decrease. We don't yet have official numbers for 2022. We're hoping that there's a decrease because of COVID. I'm optimistic, but kind of holding my breath a little bit. There are a good number of services and resources available to veterans who want our help. Our state has a proud history of collaborating across sectors and industries, launching innovative programs with little to no resources. As you all know, to be described as grassroots in New Hampshire is a source of pride for many organizations. But there definitely are some areas where we need to make some improvements for our veterans. The highest rates of veteran suicide occur in the rural areas of New Hampshire. Despite the existence of many, that this shows and that I talked about, many services and resources, veterans and their families are often unaware of their existence, or they have trouble navigating them. I often say that New Hampshire veterans don't have a resource problem, they have a navigation problem. And one reason for that is our lack of a large active military installation that often serves as a hub of information, a place where people can get referrals and services and connect with each other. It serves as a way to disseminate information for the State Department, but we don't have that here in New Hampshire. As you know, we're a National Guard state. So we just need to do a little more creative problem solving. So many grassroots initiatives crucial for veterans lack sustainable funding here in New Hampshire, relying on private grants or donations, often leading to stunted growth or eventual dissolution. Numerous nonprofit organizations provide essential services for veterans, but their reliance on unstable funding jeopardizes their continuity. For instance, we had the Military Liaison Program, which was initially funded by DHHS, and the Medicaid Balancing Incentive Program starting back in 2015. It had some positive outcomes, including an increased TRICARE enrollment for our community mental health centers. The model gained national attention. Many states have replicated it, but unfortunately funding ceased in 2017, and by 2018, only one CMHC still had a military liaison. So without financial support, these liaisons, instrumental in fostering military cultural competence within their organizations and communities, were asked to revert to billable hours in their organization. So they went back to providing services like clinical services rather than acting in that military liaison role. So it really hindered the organizational capacity to serve veterans effectively. Sustainable funding is imperative to ensure the longevity and impact of these vital programs. Ask the Question, initiated in 2015, is another prime example of New Hampshire's commendable initiatives, also initially supported by DHHS and BIP funding. The campaign featured a website, a logo, a statewide plan for military culture training, and has served as a model for other states. In just the past year alone, I've done consults with about 20 other states who want to develop their own Ask the Question campaign. But despite its national influence, New Hampshire's efforts stagnated after the funding ceased in 2017. In contrast, many states have surpassed New Hampshire. They've established legislation and allocated state funds to guide and sustain their Ask the Question campaigns. So even though I continue to help them develop and get going, they quickly, surpass what we've done, and we lag behind. But the good news is that there's so many opportunities for New Hampshire to strengthen suicide prevention initiatives for veterans. The establishment of a statewide closed loop referral system by DHHS that's hopefully going to be implemented this summer, I am super excited about. It'll allow policymakers and leaders to identify trends in service seeking among our New Hampshire veterans and assess the obstacles that they're facing in accessing those services. I expect it to make it easier for veterans to find what they're looking for and get connected to the care that they need through that. DMAVs recently convened stakeholders to identify a path forward for Ask the Question campaign. So this provides an opportunity to breathe new life into that campaign, bring new partners like New Hampshire Hospital Association to the table, and hopefully identify some new resources as well to make it sustainable. And then I also included in your folder a list of what some other states have done. I did a benchmark study recently for my own purposes, just to see what other states have done and what we might learn from them. So I thought it was really applicable here today, so I popped it in there for you. When you scan through those examples, you'll notice that many states have passed legislation mandating that service members and veterans be identified in places such as hospitals, State Department programs, corrections programs, or social service agencies. The identification is then linked to providing that veteran with appropriate resources. So currently, not all New Hampshire emergency departments, hospitals, healthcare agencies, or community mental health centers have effective practices to identify someone who has military service. Some of them ask at intake, some of them do not, but even for the ones that do ask, the follow-up when the answer is yes is lacking or not meaningful at all. When I've asked people, oh great, you do identify service members and veterans, what happens after that? The answer is usually like, well, somebody must know. I'm sure the case manager does something, and then you follow up with the case manager and the case manager's like, oh, I didn't even know we asked. So there's not really good policies and practices around that. And the legislation in some of the other states has helped to guide those entities to move forward with that. So looking at what other states have done is definitely an opportunity that we're going to seize in the coming year. Other examples you'll see are creative, innovative programs and resources that help veterans find the care and services they need and easily access them. Almost all of them have been supported by federal and/or state funds, so they can be scaled, expanded statewide, and sustainable, which is the most important part. So funding allocations as we move forward here in New Hampshire need to be clearly marked for a specific veteran initiative in order to guarantee that those funds will be used in the ways that they were intended. Grassroots is exciting, it's flashy, everybody takes pride in it, but it's not what we owe our veterans. I believe that we owe our veterans a level of commitment that's sustainable and not just flashy and grassroots. So as we, the Suicide Prevention Council, Military and Veterans Committee, move into 2024, we plan to critically assess our achievements over the past 5 years and what's required in the next 3 to 5 years to meet the needs of New Hampshire veterans and continue decreasing the rate of the New Hampshire veteran suicide rate. So I hope you can tell that I'm super passionate about what I do. Obviously, Justin and I can both answer questions now if there's time, but you do have my business card. So please, please follow up if you have any questions, or if you even just want to get coffee and talk about the veteran landscape in New Hampshire. I'd be super happy to do that. So thank you so much.
Thank you, Amy. Wonderful presentation and wonderful handouts. I'm sure there's a couple of questions probably percolating, but Brent Fraser is here too. Brent, did you want to come up and
Sir, I think, Mr. Chair, thank you for recognizing me, and it's great to be here. I think after both of what Justin and Amy provided, I would just like to express on behalf of the Department of Military Affairs and Veteran Services wholehearted support to the VA's whole of nation health benefits program, as well as what Amy described in terms of New Hampshire's suicide prevention programs, particularly the military and veterans programs. The Department of Military Affairs and Veteran Services is a partner with both. They've outlined the programs. And while I think probably most of you all are aware, there's a little over 94,000 veterans across the state of New Hampshire. Most are doing very well. They've got good jobs, they've got educational opportunities, they own their own homes. But if you look a level below that, if you look at the suicide numbers across the state of New Hampshire, and really if you peeled back what Justin alluded to in terms of the national numbers, the numbers for veteran suicide both across the nation and in the state of New Hampshire are nowhere near where they should be. One is too many, and we have well over one in the state of New Hampshire. As Amy mentioned, our numbers are coming down somewhat from 2020 to 2021. The 2022 numbers are still pending, and so we will see where those go. But I think they very eloquently described the programs and initiatives that are getting after the problem, and we would just support those programs and initiatives going forward. So I'm here in support and subject to any questions that you might have for our department to be able to provide reinforcing fires to what they shared with you all.
thank you so much, Brent. Questions for Representative Carey?
If you want, Mr. Chairman, if you don't mind, there's always one more thing. One of the things I wanted to add was one of the initiatives that came about in about the last year or so for the VA is the Compact Act. And I think it's very important that folks know about that. That legislation that came out pretty much in the last year or so allows for emergency psychiatric services to be paid for by the VA for most veterans who are other than dishonorably discharged. Which is a tremendous expansion of services to veterans. There are some specifics as far as eligibility is concerned, but it provides 30 days of residential care and 90 days of outpatient care for a total of 120 days for somebody who's in that crisis situation. That also includes if an ambulance ride is needed to get to the ER, and it doesn't have to be a VA facility. It's wherever the veteran wants to go or whatever the nearest support is. There's some other eligibility issues, whether somebody's a reserve or guard and how long they've been active for, but that's something that, sort of those details can get sorted out with the case managers and folks that manage that. But I think it's important that folks know about that's available.
Thank you for that, Justin. Representative Carey?
Yes. Can you tell me how veterans, whether active or out of service, get this information that we've gotten today? How do they know to access service? Is there signing out, say, oh, by the way, here's a little pamphlet for you? How do they get this information?
You just described one of the challenges that I think those of us in the veteran services world struggle with is getting that information out there. While it doesn't apply to every situation, what is common is when you've got somebody who's leaving the service, transitions in care, transitions from life transitions are known to be risky situations for veterans. When somebody's leaving active duty, they're focused on housing, they're focused on getting a job, they're focused on doing a lot of things. And many times, but not always, there is, it's later on that the person starts thinking, hey, I need to connect with the VA. That person may have gotten the information about what to do when they got out of the service, but they might not have been ready to hear it. So every veteran service organization that I've encountered in New Hampshire has been eager to get the word out to, things like event calendars and sort of getting the word out. These are things that it's definitely a challenge. I talk about it with the coalitions that we've built. How do we get the word out? How do we connect with veterans in the community? And it's not easy, but it doesn't mean we're just going to stop. We'll keep doing it. I know the VA's got social media presence. Many of our a few of our coalitions have, just trying different ways to connect. But I appreciate your question because it is probably one of the biggest challenges.
Right, follow up?
Hello.
One of the questions that was asked of me was that, is there any way, since it seems like every veteran, regardless of their personal situation, has a phone, is there any way you can text links to services or that sort of information via their phone so that they have it with them whenever it is that they need it?
One of the things I did want to add from your previous question, then I'll get to that. The VA does have social workers working in the military to VA program. It's a transitional program. They're social workers whose job is to help veterans transition from their care and military medical support to the VA. But again, the challenge is we have to identify the veterans. We have to get the word out. That's where the New Hampshire Ask the Question campaign is really wonderful. And it's just constantly pushing it out there.
A comment for you all. I just had a note or a mention from our researcher. There is a Health and Human Services Oversight Committee that's chaired by Representative Mark Pearson. I'm not sure if you've had any interaction with that committee with Mark, but I would recommend that you make a note. Mark Pearson is a state representative. He's actually used to be with Health and Human Services Committee. He now chairs the Child and Family Law Committee. In fact, he and us share that office right there. So Mark would be, and his oversight committee would, I think, be a wonderful potential resource to interface with. So would encourage you to reach out and just connect with Representative Pearson. His son's in the legislature too. This is Mark, the father, who's, say again, Representative? Yeah, the son, right. Steve is the son, and Mark is with the oversight committee. Anything else? Other question? Representative Massimella?
You were mentioning that you have 8 coalitions throughout the state. Do you have anything above the notch?
The furthest up that we've been able to organize folks is Conway, which is Carroll County, and then we have the central region in Plymouth. There are some challenges when it comes to catchment areas. When you get above the notch, that's White River Junction. There's a lot of great programs up there. We've reached out. One of the things that is really been great, as I've learned about New Hampshire, and Amy mentioned the grassroots efforts around the state. There's a lot of great folks out there that are working on these things. There's some really great supports already existing up in the North Country, but we do not yet have a coalition there, but we're also not done building coalitions either.
So possibly in the future?
Hope so.
Well, if I can help you, let me know.
Okay.
Thank you.
Representative Massimella is from Littleton, which is just barely in the North Country. Some people argue if it is or it isn't. I'm from Groveton originally, which is definitely North Country. Anything else? Representative Shurtleff.
Thank you all for being here today. just my own story. I served in Vietnam and carried a lot of baggage back with that. And I had the bright idea that if I went back to Vietnam to see it the way it is, I'd stop remembering how it was when I was there. And I went back 7 years ago, and of course, the luck of the Irish, I arrived and it was the anniversary of the unification of the North and South. And everywhere I looked, there was a picture of Ho Chi Minh looking down, smiling on me. And I was supposed to be there 10 days, but I had to leave after 8 because places that I went to where I knew things happened, especially during Tet, was now a Nestle's or a Michelin or some corporation was there. And I came back and saw a counselor, and she was a wonderful person, but it was like I was talking a foreign language when I tried to explain things like, what different phrases and things meant, and she didn't seem to understand. And I think there is something, we talk about functional alcoholics. I think there's a thing called functional people with some form of mental health that do have college degrees, are working in professions. And part of my concern about going to VA was I felt there was a stigma attached to that. And so, but this person I saw her about 4 or 5 times, and she was terrific, but she had no idea in a way. And I think it was probably because more me than it was her. So I eventually went to VA, and that was the best thing I did because everything that I was afraid about VA, I heard about it was just the opposite. And once a year now, I get a call from the doctor saying, how's things going? You okay? And, and they are always reaching out. And so like, I think sometimes we think it's the lower economic segment of our communities that struggle, but it can be anybody at any time. And if you're a Vietnam vet, don't go to Vietnam in September.
Representative Shurtleff, thank you for your service. And I think, are there other veterans on this committee? Thank you as well. Just wanted to recognize that. Again, we're talking about the Ask the Question campaign. I figure it makes sense we should do it here. And listening to your story, I really appreciate that. One of the things that we've been doing in the Military and Veterans Committee is really looking to promote military culture training. It's a little bit more than just understanding rates and ranks and branches of the military. It's understanding a little bit more about how soldiers and sailors and airmen think and behave and act and things that they expect. And when a clinician has taken that extra step to try and understand that culture better, veterans can feel that, if that makes sense. And that's important. And that's something that we look to continue to spread that training around the community. One of the initiatives with the Lakes Region Veterans Coalition is they've put together a training of suicide prevention, military culture, and self-care. And they've been presenting that to the Lakes Region Community College EMT program. They're expanding that to the nursing program there as well. And these are folks that are entering the field who are going to be taking care of folks in the community. And, ideally, these folks have a leg up to be able to address some of the issues that you've identified.
Rose again, use your hand up.
Yes. Been listening to Representative Shurtleff. We had discussions on that. I was in the Navy during the Vietnam era. I never served in combat. I never got into a fight except with other shipmates. Now, when I got out of the military, I went to work. I was a police officer in Manchester for a time. As a matter of fact, Representative Shurtleff and I we went to the academy together back then in 1970. I did go through an anti-war demonstration, which kind of messed me up a little bit. Not suicidal. I never thought of being suicidal, but there was only 4 of us against around 250. And I thought my life was over. And I had something clicked inside my head. And I remember thinking to myself, it was either, I had a pucker factor, if you can be gross, either fight or flight. Something clicked in my head. I said, if I'm going down today, somebody's coming with me. And I started lashing back, and we were all pretty effective until the rest of the cops showed up. thank God that not everyone who were demonstrating wanted to get involved in the fight. But there were some in there who, every time you tried to make an arrest, you get pounded in the back. So you let the person go. And they were hoping that you'd go into the crowd. Then you were me. And I remember I couldn't shut it down. That night when it was all over, I went back, you need, okay, Gagny, go back to your route. And I asked the captain, I says, Captain, I said, I need to go home. He says, why? You're a police officer. You go out there and do your job. I says, I don't feel right. I couldn't put it into words. You're a police officer. Man up. Keep that to yourself. Go out there and finish your route. Well, I ended up shooting somebody that night because they were getting away. And another one was not going to get away. That absolutely, Representative Shurtleff knows about this story, absolutely ruined my career as a police officer because I didn't want to do it anymore. And I got over that, but I had flashbacks for about a year and a half, 2 years. After that, I was yelling at the bullet to come back into the gun, literally yelling. And I'd wake up and my wife would say, "What's the matter?" I said, "I had that dream again." Oh, for crying out loud, right? The thing was, in my estimation, that they did not have someone there who could talk you down and calm you down, and but by golly, send you home to rest up, because I couldn't click off. I was looking for trouble. I was looking to get somebody, and they couldn't. Apparently, they couldn't get that through their head. I can't identify with some soldier, Marine, anybody who's been in combat. So there's no way that I could counsel with them because I wasn't there. I didn't know any of that stuff. But I was there when I was getting hit and I was hitting back, and I wasn't going to survive. That's how I felt. And if somebody that night would have, a captain would have said, "Yeah, go home, Larry, and think it over and just relax, and give me a call, come and see me, come and see this chaplain, whoever," I think I'd have retired as a police officer. I was up for sergeant after 2.5 years, because I was doing my job. But that just absolutely ruined it. So because nobody wanted to listen. So that's my.
Thank you for that, Representative Gagny. And thank you, Amy and Brent and Justin. We're going to take up a Senate bill on an Irish Trade Council. You're welcome to stick around for that if you'd like. And thank you again. Thank you again for your patience in having to make 2 trips here. Very much appreciated.
Thank you. I just want to encourage folks, in the stuff that I gave you has my contact information. If you want to share that with anybody else, or if you're interested in connecting with me outside of this discussion today, I'd love to follow up and hear what your thoughts are.
Thank you, Justin. Representative Rollins has
Do
a
you
question.
have any of your business cards with you? Because that's easier for me to keep in my wallet. If we could get one of those. That's, yeah, I got that one. That's Amy's.
Oh, that's Amy's.
Yes, I have business cards.
Okay, thank you.
Welcome, Mr. Speaker. We were just going to have Representative Shurtleff, who is very Irish, introduce this measure, but you are here, and do you mind if we ask you to introduce it? We'll call this hearing to order, the chair recognizes the Speaker of the House, Representative from Londonderry, Representative Packard, on SB 317. Great number, 317. Thank you, Mr. Speaker.
Well, thank you, Mr. Chairman and members of the committee. Senator Bradley couldn't be here today, so he asked me to introduce it for him. And even though I am a sponsor of it and I knew what it said, I just actually read it today, you know, from top to bottom. So basically, it sets up a New Hampshire Ireland Trade Commission. And I'm not going to go through everything in the bill, but I think we're the 6th largest trading partner to Ireland. And I think you've all met, or most of you might have met, Senator Mark Daly. And, you know, he's been over here, and he called me Friday afternoon on my way home and said, do you want me to fly over for today's hearing? I said, Senator, I said, it might last 15, 20 minutes. He says, I don't care. I'll be over if you figure you need me. So I told the senator, I said, I don't want you flying from Ireland for a 10-minute meeting, but if you want to, that's fine. But he decided not to do it. So this basically sets up a trade council so we can work closer with our Ireland trade partners. And I don't see anything but good coming out of it. That's about all I got. I mean, it's fairly uncomplicated. I hate to, after being as many years in this institution, say that this is a simple bill, but I truly do believe this is a fairly simple, straightforward bill. And with that, I'll try and answer any questions that you may have, Mr. Chairman or members.
Thank you, Mr. Speaker. I was going to ask you if you would take any questions. Are there any questions for Representative Packard? Representative Massimilla.
Thank you, Mr. Speaker. I was just wondering, what precipitated this bill now?
I think the fact that we seem to have established a much closer relationship. I was over there in 22 with NCSL, one of the trips over there, and we spent 3 days with Senator Daly, when we're over there, and we started talking about this kind of thing, as far as he'd like to set up a trade council in almost all his states, all the United States and each individual state, so that obviously we could work closer together. But I think that we are a little bit closer than some of the other states, seeing that if you look at it, the first settlement was in Nutfield, which is now part of my hometown. Nutfield used to encompass Londonderry, parts of Daly, parts of Manchester, parts of Windham, until it was broken up. So there is a little bit of discussion as to whether it was Derry or Londonderry where the first potato was grown. I can tell you it was Londonderry. I was there.
Thank you for that, Mr. Speaker. I also read the measure, and I saw the town of Nutfield, and I thought I knew where every town was in New Hampshire, but Nutfield, I did not know until now.
Technically, it doesn't exist anymore.
Nutfield, okay. There have been, I see the measure calls for 2 representatives to be in the Trade Council. There are a number of volunteers who've already stepped up to fill that role. We can get you those names down the road. Other questions? Go ahead, Mr. Speaker.
I've had numerous requests to be on the Trade Council. Yes. Yeah.
Not everybody wants to be on a commission or a committee, but this one seems to call to some of our people. Anything else from the committee? Representative Shurtleff?
Mr. Speaker, would you be amenable to stick around for an executive session, seeing how we're short a body? I would be amenable to that, yes. Thank you.
Thank you, Representative Sherliff. I was going to point out that we are one shy of a quorum. We had a request in yesterday to the office, and with the powers vested in the speaker, I'm sure that that would work if you.
Well, we were just talking about that over in the office because I was under the impression you were down too. So we were just talking about that. So I would give me a couple of minutes to make sure that they haven't already filled it.
Absolutely. We will, if there's no other questions and did you give us a pink card, Mr. Speaker? We'll fill it out. We'll fill it out for you. Representative Carey?
What opportunities do you see for this trade council in terms of improving or expanding relationships with Ireland?
Well, I think our goal is after we spent when I was over there with the NCSL delegation in 22, we did talk about the number of businesses that are already involved, between our two countries, and we hoping our hope is that this will expand, the cooperation between our two countries, and thus actually hopefully increase the companies that are doing a lot of trade with Ireland, and hire more people, and obviously vice versa.
Anything else? Representative Siebert?
Hi, thank you for taking my question, Mr. Speaker. I was just curious, and it could just be me, but I was just wondering, when I looked at it online on the docket thing, was there an FN attached to this, like a fund thing, or is that not there anymore?
If you look at the back, it does have a fiscal note, and as so many of the bills that we get, this is indeterminable at this time, and it's going to be something that's self-funded. It doesn't look like it's going to require any state funding.
Okay, all right, thank you.
Representative Sherliff?
Yeah, just to follow up on that question, I think it's very comparable to the Canadian American Trade Council, which Linda and I both belong to. And I think their funding is like $8,000 a year that goes to the Secretary of State to fund that. And so I'm sure this would be comparable. And so when this bill came to the floor, it wouldn't have to go to finance as a second committee because the funding amount is so small.
And it is, as the back says now, it's still indeterminable.
Yeah.
As you well know, Mr. Speaker, you and I went through most of all the bills, and
did.
how many came up indeterminable, or the fiscal note where he's turned into the clerk's office when
More
it's ready.
than not. Yeah.
That's a good question, Representative Siebert. The word indeterminable I've seen many times.
Not as many as I have, Mr. Speaker.
If there are no further questions, Mr. Speaker, if you can help us with that quorum issue, we need the one more person, and then we'll exec this measure.
Okay. Let me find out if if they've already got somebody appointed or not, and if not, I can sit in.
Welcome.
Congratulations.
Welcome. Now we need you to leave that seat and take a seat between these two reps over here, if you would, or if you prefer another seat, take your pick, Mr. Speaker.
Mr. Speaker, this is called a battlefield promotion, I believe.
You want my seat? Sit up here.
Mr. Speaker,
You are right.
between those young reps would work fine, I think.
The thorn between the roses.
Representative Sherliff can say that. I would never dare. So at this time, we're looking, when Madam Clerk is ready, you ready to go into an exec session, Madam Clerk? Okay. We will expeditiously go to an exec session, and I am looking for a motion. Representative Sherliff with the green tie.
I'd move on to pass.
And I will second that, Madam Clerk. The motion is OTP on to pass on the appropriately numbered SB 317. And Mr. Speaker, Representative Sherliff, would you care to speak to your motion?
Well, I think as the bill mentions, there's a great history between the United States and Ireland. The towns that were settled from people from Northern Ireland and Derry, Londonderry, in that area. One of our governors and Civil War, Revolutionary War General John Sullivan was the son of immigrants from County Cork, Ireland. The fact that here in New Hampshire during the Great Irish Famine, which really wasn't a famine because grain was being shipped out of Ireland, it was the Shakers in New Hampshire that sent food to the Irish during that period. And I think, like I said, that long connection and the fact that my own mother came here from Ireland as a little girl before the Troubles started in Ireland because her father was involved in the Irish Republican Brotherhood. And, I think it's great that we are finally doing this, and I commend the Speaker for his work in getting this legislation before this committee, and I'd ask the committee to vote on to pass this. We can get it on consent.
Thank you, Representative Shortlift. I will add, having seconded this motion, that my mother's grandmother was also from County Cork. My dad's family is from Galway Bay Area. It was a thrill to visit there once. I hope, whether you're Irish or not, that you get a chance to visit the Emerald Island, and I'm happy to second the motion. Any other comments, questions? Yes, Representative Lloyd.
Just for my own curiosity, just so I can learn a little bit, the 400 million in Granite State goods sent over there. What do we send? Like,
The question is, what goods do
Yeah.
we send as part of the trade relationship? What goods do we send to Ireland? I know Representative Pearl honeymooned there, and I'm sure the maple syrup is part of that equation. But Mr. Speaker, or does anyone have some better information on that?
Unfortunately, Mr. Chairman, I do not have a list of all the companies that we interact with. Some of them were mentioned a couple of years ago when I was there, and I'm sorry, can't remember.
That is a very good, relevant question, given the nature of the measure, and we'll find that out. Especially if I end up on this trade council, I will definitely get back to you, Representative. Anything else? Okay, seeing none, Madam Clerk, when you are ready, the motion is to pass on Senate Bill 317, when you're ready.
Okay, Representative Rollins.
Yes.
Representative Packard. Representative Gagne.
Of course.
Representative Mannion.
Yes.
Representative Shurtleff.
Yes.
Representative Massmilla.
Yes.
Representative Carey. Yes. Representative Toll. Oh, no Toll today. Representative Lloyd.
yes.
Representative O'Neill.
Yes.
Representative Siebert.
Yes.
Okay, did I miss anyone?
Chair.
Chair.
Chair says aye.
Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. 2-0.
11 to nothing. 11 to nothing. This, without objection, will head to the consent calendar and on to the full floor. It's already passed the Senate, obviously. And thank you so much for helping us to get through this, Mr. Speaker, Representative Packard. And with that, we'll call an end to this executive session. We know two of you have to go to another trade council. Before you leave, real quickly, as I've mentioned, I sent everybody a message. Two things we have left. We have to take care of HR 31, and we also have a request, and if it's granted, to spend some more time on the wording on HCR 8. We may be able to make an announcement on Thursday and have a session and finish everything on Friday. So if you can't make it Friday, we will need subs as required. And that's all that I have. So we'll see you in the big house I mean Reps Hall, on Thursday.
I just want to thank the committee. Thank you very much.
Committee this year?
So I have a quick question before we all leave. Should we not put this on consent?
Mr. Speaker, Representative Carey makes a interesting point in question. As with the Taiwan resolution, which we did pull off consent so that we could speak to that briefly on the floor, do you see any utility in not putting this on consent so that someone can speak to it on the floor? What is your sense? Okay. Okay, we will have a wonderful committee report, though, guaranteed. So, thank you for that. That's a bit of blind.